Best breathing technique for anxiety and hypersensitivity. Updated, June 15, 2025 by Dr. Mohammed Hossein Hariri ASL. Time to read, 7 minutes 47 views, no comments. Table of contents. Video of best breathing technique for anxiety. Why diaphragmatic breathing works for anxiety. Step-by-step instructions for diaphragmatic breathing. Making deep breathing a daily habit. Combining diaphragmatic breathing with meditation. Long-term benefits of deep breathing for mental health. Conclusion. If you suffer from anxiety or hypersensitivity, the right breathing technique can bring immediate relief and long-term emotional stability. This article introduces diaphragmatic breathing, also known as deep belly breathing, as the best breathing method to calm your nervous system. Designed for people with anxiety disorders or sensory processing sensitivity, this simple technique uses controlled breath cycles to reduce stress hormones and activate the parasympathetic nervous system. Practicing this technique consistently can help you sleep better, manage panic attacks, and become more emotionally resilient. It's an evidence-based approach used by therapists, mindfulness experts, and psychologists worldwide. In this guide, you'll learn exactly how to perform diaphragmatic breathing, when to use it, and how to make it a daily habit. By the end, you'll feel empowered with a powerful yet gentle tool to manage your anxiety naturally, no medication required. Video of best breathing technique for anxiety. Why diaphragmatic breathing works for anxiety. English documentary on panic attack with vocabulary practice in context and transcript of video. People with anxiety or hypersensitivity often have an overactive sympathetic nervous system, the part of the brain responsible for the fight or flight response. This makes their bodies more reactive to stress and perceived danger. Diaphragmatic breathing counteracts this by engaging the vagus nerve, which promotes relaxation and a sense of safety. When you breathe deeply from your diaphragm, rather than shallowly from your chest, your heart rate slows, your muscles relax, and cortisol levels drop. Clinical studies show that diaphragmatic breathing can reduce symptoms of generalized anxiety disorder, GAD, panic attacks, and emotional dysregulation. Step-by-step instructions for diaphragmatic breathing. Follow this step-by-step guide to practice diaphragmatic breathing effectively. Find a quiet space, sit or lie down in a comfortable position. Relax your shoulders and place one hand on your chest and the other on your belly. Inhale through your nose. 4 seconds, breathe in slowly and deeply through your nose. Make sure your belly, not your chest, rises as you inhale. Hold your breath, 4 seconds, gently pause at the top of your breath. Avoid tensing up. Exhale through your mouth, 6 to 8 seconds, purse your lips slightly and exhale slowly. Focus on emptying your lungs completely. Pause briefly, 2 seconds before your next inhale, rest for a moment in stillness. Repeat for 5 to 10 minutes, aim for at least 1 full session per day. You can also use this technique during stressful situations, like public speaking or before sleep. Pro tip: you can use calming background music, nature sounds, or a guided breathing app to assist with your timing and relaxation. Making deep breathing a daily habit. English presentation on meditation benefits with feedback for IELTS and TOEFL. Like any skill, the key to mastering diaphragmatic breathing is consistency. Here are some ways to build this habit into your daily routine. Start your day with 5 minutes of deep breathing. This sets a calm tone for the rest of your day. Use breathing cues. Link your practice to daily habits, like brushing your teeth or drinking tea. Keep a breathing journal. Track when and how often you use the technique and note any changes in mood or symptoms. Practice during anxiety spikes. Instead of reacting emotionally, pause and breathe deeply for a few minutes to regain control. Pair with mindfulness or yoga. These practices often use breath as an anchor to keep you grounded and present. Combining diaphragmatic breathing with meditation. Diaphragmatic breathing is an ideal companion to meditation, especially for those dealing with anxiety or hypersensitivity. In many mindfulness and meditation practices, the breath is used as an anchor to bring awareness into the present moment. When you incorporate deep belly breathing into your meditation routine, you naturally reduce mental chatter, lower cortisol levels, and ease into a more relaxed, focused state. This dual practice can be especially helpful for beginners who find it difficult to quiet their minds, as the physical act of controlled breathing gives you something concrete to focus on. To practice them together, begin by sitting in a comfortable position with your spine straight. Close your eyes and start with a few deep diaphragmatic breaths. As you breathe in and out, allow your attention to settle on the rising and falling of your belly. If your mind wanders, gently return your focus to your breath. Over time, this combined approach can deepen your meditation practice and build emotional resilience, making it easier to manage daily stress and anxiety. Long-term benefits of deep breathing for mental health. Incorporating diaphragmatic breathing into your daily life offers more than just immediate stress relief. It leads to long-term improvements in mental health and emotional regulation. Over time, consistent deep breathing rewires your nervous system to become less reactive and more balanced. This is particularly beneficial for individuals with anxiety disorders or hypersensitive personalities, whose stress response systems are often on high alert. By regularly activating the parasympathetic nervous system through deep breathing, you gradually train your body to remain calm under pressure. Additionally, long-term practice can improve sleep quality, reduce muscle tension, and decrease the likelihood of panic attacks. People who commit to daily breathing exercises often report increased emotional awareness, better concentration, and a stronger sense of control over their mental state. This technique also supports mindfulness and emotional resilience, helping you navigate challenging situations with more clarity and less overwhelm. Even just 5 to 10 minutes a day can create measurable changes in mood and physiological health. Whether used on its own or in combination with therapy, meditation, or physical exercise, diaphragmatic breathing is a cost-free, drug-free, and accessible tool for long-term emotional well-being. It empowers you to become an active participant in your own healing and mental balance. Conclusion. For people with anxiety disorders or hypersensitivity, diaphragmatic breathing offers a natural, safe, and effective way to regain calm. By learning how to slow your breath and connect with your body, you give your nervous system the chance to rest and recover. Make this technique part of your daily life, and over time, you'll likely notice reduced anxiety, better emotional regulation, and a greater sense of peace. Share this post. Facebook, Twitter, LinkedIn, Pinterest, Telegram, email. About the author. Dr. Mohammed Hossein Hariri, ASL. Dr. Mohammed Number of posts, 4182. Related posts. English presentation on healthy lifestyle and well-being. English presentations to practice speaking. The Eagle and the Arrow by Aesop with vocabulary. English short stories. New Year, New You, top transformative resolutions for 2025. Thriving in life, success and happiness. Anxiety, heart meditation, mental health, mindfulness, peace of mind, safety, sensitive, stress, well-being.